Department Advisory Committee to order. And we have all received a copy of the minutes. I don't believe I was there, so we'll take a motion to accept the minutes or mention any corrections.
So moved, Terry.
Okay.
I'll second.
Great. All in favor, aye?
Aye.
Aye.
Opposed? Wonderful. Update on funding. Those are always exciting.
So this is not exciting for us, but so I just wanted to make sure everybody was aware that last week the feds, well, the CDC on Monday night reached out, and then the state received word actually though on Tuesday morning that several grants were being discontinued effective immediately. So our ELC grant, our local public health disparities grant, and then 2 of our NATRO grants. Well, yes, we were told 2 NATRO grants and then we were able to get back one of them. So we ended up losing what worked out to be around $350,000 of funding in one day. And we were given a short window to be able to get all of the invoicing done and reports submitted. So we were able to get that done. But last week was a very hectic week trying to get that all done and then trying to find alternative funding to ensure that staff could continue being employed and we could continue working on our mission. Fortunately, we had public health infrastructure grant that I had held on to for a few months with the expectation that some of these grants were already scheduled to go away this summer and that we would be switching staff over to that. So we have just done that earlier than expected. We are moving forward, but we also recognize that additional grants could be ended at any time. And so we are aware, we're doing our best to move forward. We are still trying to carry out our mission every single day. But I just wanted the Board of Health to be aware. There were other departments, health departments in our area that did have to let people go immediately. So we were fortunate in our case not to have to let anyone go at this time. But I wanted to make sure that the board was aware.
What was the other grant, Christina, that you said you had kind of held on to that you used?
It's FIG, it's Public Health Infrastructure Grant. It was a grant that was given with the express purpose of retention of certain sorts of public health staff. And so we had written in for our budget that certain staff would be retained under this grant when funding ran out. And so the plan was always that many of them were going to start moving over this calendar year to that grant. But you know, the FIG grant is not a bottomless pot of money. And it's not one that is expected to be renewed. So the state is also scrambling. I recognize that there were several people at the state who immediately lost their jobs. It was one of those things where, you know, we went to go submit our invoices and reports only to get bounce back messages that those people, those contacts for us for those contracts were no longer employed by the state either. So it was a jarring experience last week for us.
Yeah, I'm sorry.
Thank you.
I think
Dr.
Terry,
Marsh,
you're
you're muted.
muted. Sure. There's maybe a mic icon on the top bar.
It won't let me unmute you, so there you go.
Oh, there I am.
Perfect.
Yep, not sure what all that was, but that's all right. It's not surprising news that you gave us, but it's nice to know kind of the extent and the blessing you were able to hold on to the staff so far. So, moving on, an update on communicable disease. You still believe that diseases are communicable, I'm assuming?
We do. We
Okay.
do.
Okay.
But so flu season is starting to wrap up. There's still some cases coming in. Influenza B had a slight uptick in March, as it usually does at this point in the season. We did see our cases, at least for February, for influenza A, were at about 3 times what we saw last year. So this was a really big flu season compared to more recent years. COVID cases are also decreasing. We did see a spike in those winter months as well, but they were much lower than the flu cases. For example, we had 622 influenza cases in February, and we only had about 250 cases of COVID at that same time. Whether or not that's due to COVID being lower or people just testing at home and not going in to seek care, I'm not totally sure, but there were less cases of COVID. In addition to our respiratory viruses, we have seen about 52 animal bites so far this year, 14 tuberculosis cases, which is both our latent and active cases, some Campylobacter cases, some pertussis and varicella, and then about 61 STI cases. Those are kind of unreported, as if they go to healthcare facilities outside of Independence, I don't always see those cases. So our STI cases are pretty underreported within Independence. We have not had any measles cases yet, but we're keeping a close eye on all of the outbreaks. We have been receiving a lot of calls lately about measles vaccinations and whether or not people need to get revaccinated, if we're able to check their vaccine records for them. And then we've been referring people either to their primary care doctor if it's a situation where they could be revaccinated, could not, or to a CVS just to get a vaccine if they haven't had it at all. That's pretty much what we're seeing right now.
Are you able to hear me?
Yes.
Yeah.
Okay. Like I said, I'm kind of jury rigging something here. This is Legler, but I assume you're getting data from the state health department. Are you able to get data from the CDC at this point, or is that becoming a problem?
We're not getting a bunch of data from the CDC or the state necessarily. There's not a lot of data we typically are getting unless it's cases that are like in nearby jurisdictions we need to be aware of. For the most part, we mainly just look at Independence data.
Okay.
So are you able to access state COVID data? Because I know I still follow that, even though we're past the pandemic, and Missouri is in the wonderful gray zone of we don't know nothing about no diseases in our state. So do they share data with you as a health department?
We see the public facing dashboards for our data. I can put in specific requests if there's additional things that we're looking for, but for the most part, the main data we see is the same public facing dashboards.
But we see some upticks in some areas, and I know that, like I said, Missouri doesn't play ball with the rest of the country for the most part. And I know nationally there's an uptick in TB. So are your TB numbers up for us, or is that kind of what we're usually seeing?
It's about the same as what we normally have. I'd say we've had a couple more active cases this year, but I think it's just when we happen to catch some of them, a lot of them go in for other things. And then we see TB, we've had a couple more active, but they have been transferred in from other jurisdictions, from what I'm remembering for most of them. So locally, we're not really seeing an uptick in our cases, just about the same as normal.
Any other questions for Lauren? Hearing none, we'll move on to strategic planning for suicide prevention.
That's still me. So
Hey.
one of our NACCHO grants that we received was the Expanding Community-Based Suicide Prevention grant. About, I think it was 35 health departments applied for it, and we were one of 2 that received the grant for the planning track. So earlier in March, we did a 2-day strategic planning session in person with our partners from the Mental Health Task Force. We had 13 organizations represented. NACCHO came in and led that strategic planning session. Over those 2 days, we developed a practical vision and then strategic directions that are going to serve as the basis for the strategic plan that we're creating. And I can share my screen to show you those because it's kind of a lot to just list off. Potentially, if I can get it to actually open. That is always the question. It wasn't opening earlier. Okay. Can you see that?
Yeah.
Okay, so we started with kind of a higher level picture. The question we had was, in 3 to 5 years, what do we want our community suicide prevention efforts to look like? So we worked for almost a whole day to drill down to these 8 kind of practical visions of what we're hoping for. So the partners and us settled on, we have integrated care coordination, culturally responsive services with language access, increased use of evidence-based methods and best practices, an educated and empowered community, engaged and invested stakeholders, reduce barriers to accessing care, increase capacity among a comprehensive workforce, and collaborative actionable data systems. So that was kind of like the 3 to 5 year, what they want our suicide prevention efforts to look like. If someone was writing a newspaper article and was like, well, what do your prevention efforts look like? These are the 8 things that we would want to be able to say about what we're currently doing. So from that, we drilled it down to 5 strategic directions. And within each of these 5 strategic directions, which is how we plan to work towards that vision over the next 2 years. So we wanted to, I'll scroll down here because we kind of broke it down. It's a little hard to see. So we came up with different themes and ideas from a brainstorm and then broke them down into the 5 different strategic directions. So the first direction is aligning and organizing resources. The second is empowering community engagement in prevention. Then we have strengthening and formalizing partner collaboration, which includes partnership engagement and data sharing. Promoting protective factors, which includes expanding evidence-based programming and then making meaningful connections. And improving the responsiveness and efficiency of the continuum of care. And so what we're going to do moving forward is, for each of these 5 strategic directions, an implementation work group was created based on which partners felt like they could contribute most to that strategic direction, as well as at least one member of the health department in each of those groups. Those work groups are currently working to create 2-year success indicators for that strategic direction. So how would you measure that we've successfully gone in that direction in 2 years? And then also created 3 to 4 SMARTY goals for that first year of what we hope to accomplish in the first year. We're going to take what the work groups have and turn it into a 90-day implementation plan. So that's kind of where we're at on that grant, if anyone has any questions.
I don't really have any questions. The school district is still separate from the health department as far as their management of suicide, mental health issues. Is that correct?
That is correct.
Okay, and we're not sharing data back and forth as far as what's going on there?
I don't believe so. I know they have invitations to join the mental health task force, and sometimes when they're free, they'll be there at a meeting. They've been at least one that I've been at. They were not available for this session though, but we continue to include them when we have the opportunity.
Great. Any questions about that issue for Lauren? Okay, thank you so much. You presented a lot of information for us. We appreciate it. I had a couple things, and Christine, it's still okay if I touch bases on those things?
Yes, I verified. We gave 24-hour notice publicly, so we're good. If
Oh,
you would like to
okay.
share, you're fine.
I just didn't want to wind up being abducted and sent to another country overnight. I've been asked to be on a representative of the Health Department Advisory Board on two different organizations, and I kind of wanted to give you an update on those. One is the CDBG, the Community Development Block Grant Advisory Committee that meets on an annual basis and takes federal block grant money and helps evaluate people who have applied for that money from the city. And it is for use within the city. So we sometimes will have organizations that will apply for funds and 10% of their clientele are in independents. And so, 90% is not. So that may not be who we want to send the money to. So we met 3 times this year in January, February, March. January is basically to review what the focus of this year's grants was. And the focus oftentimes changes from year to year about what's going to benefit the community. And this year they chose dealing with homeless population and housing insecure. It's actually a fairly significant problem in our community, and it may be getting more significant. We had 12 different organizations that submitted requests for funds from us. 11 have requested in the past. It's usually the same 12 or 13 groups that ask for money. They kind of tailor their request to kind of fit what the focus of this year's funding is. But those organizations also deal with lots and lots of different problems. This year, Child Abuse Prevention Association, Community Services League, Hope House, Independence Meals on Wheels, Metro Lutheran Ministry, Mother's Refuge, the Northwest Community Development Corporation, the Palmer Senior Center Nutrition Site Program, Restart, which deals with accessible housing. Salvation Army presents 2 different requests, one from their Crossroads Family Shelter and one from their Emergency Assistance Program. And this year we had a new organization called Upwards Care, which actually is a for-profit organization. We've never had requests from a for-profit organization before. And they work with private child care providers and help them work on nutrition and affordability and child development, a number of different things. We have hopefully about $130,000 that will be available. We actually have no idea knowing whether that will be available or not. And I reached out the other day and we still have no idea. That money comes in over the course of the 12 months and it's distributed over the course of 12 months. Those organizations submit, this is the money we spent of what you had granted us. And then they are reimbursed for that money. So it's not like we just write a check for that amount and give them to them. The second meeting we had was in February, and each of the organizations did a 5-minute presentation, a question and answer, and then we met again in March to decide what funds were going where. And we think we had a successful year of dealing with that. As a rule, the amount requested is twice or more of what we have available. So we decide whether we're going to give them 50%. Dealing with unhoused and housing insecure it's challenging sometimes for these groups to explain to us how Meals on Wheels is going to help someone from being unhoused. But it does in many ways, because that's a significant food is a significant portion of their income. So it was a successful year, and I think we had a nice series of meetings. We have representatives from the school district, the Board of Health, Truman and Heartland Community Foundation, Independence Ministerial Alliance, and the Chamber of Commerce. We have vacant positions from the Rotary Club, interestingly enough, and from the Labor Management Council of Kansas City. So if anybody knows somebody that's in Rotary or Greater Kansas City, it's not a huge commitment. I mean, going through all the data takes a while, but it's 3 meetings once a month for a few hours, and it could encourage them to reach out. It would be nice to have more input as to what goes on. So those meetings were successful. The other meeting that I've been attending, and unfortunately Dr. McCandless isn't here because she's actually the chair of this. There's an unsheltered work group that's meeting about every other month now, and it has representatives from Community Service League, Habitat for Humanity, Greater Kansas City Coalition to End Homelessness, Drone Farm, the Heartland Center for Behavioral Health, Comprehensive Mental Health, Link, Mid-Continent Library, and multiple other organizations that get together, and it's almost a think tank of what can be done, what services are we doubling, and how could we be more efficient and reach those people that are unsheltered or housing insecure. They did some very, very nice work in the last year. It's fascinating when you look at unhoused data. We used to decide who was unhoused in your community by going out one day in February. Generally, it was when it was about 27 degrees below zero, and you would count everybody who was unhoused, which was like 4 people. They actually did a much better job this year, and Independence, Eastern Jackson County is probably looking at somewhere between 150 and 200 at any given time. And they did a much better count, and they're doing a nice job of trying to find ways to assist those people. The school district is involved with that because there's a huge number of students that are couch surfing that are actually unhoused, but have a house to be in. It's just their neighbor's house or their best friend's house or somebody in the district's house that they are currently residing in. And so they don't get counted in the unhoused population that are living in their cars or living in their tents or living in the Walmart parking lot. Walmart luckily allows people to live in their parking lot without retribution. There is some, and I'll come back to the meeting once this is more formalized. There's some wonderful work being done, and the facility actually is going to be in Raytown, not Independence. But the homeless people don't pay a whole lot of attention to the city limits. I don't know if you've ever noticed that before. They don't really care whether they're in Independence or if they're on the Raytown side of the street or the Blue Springs side of the street. And so they're working at a facility that will provide medical care, dental care, behavioral care, housing support, resource connections, identity documents, which is becoming increasingly more important. And so hopefully that is coming to fruition. Currently, they're having some problems with being able to provide showers and things like that, but that's just due to the facility, which is a church that has allowed this organization to utilize its facility. So that's hopefully be something I can come back to the committee about, because it really is going to make an impact on homelessness. As the current Social Security and Medicaid and all those other things unfold here in months to come, the picture will change, but we'll deal with it as it comes out. Questions about any of that? Nope. Dr. Legler, I hope you get your computer going.
It's been a little bit of a challenge, but I think if I have more free time to be able to concentrate on it, but there's been too many distractions.
I hear you. Any other business that needs to come before the advisory committee? No. Well, we certainly thank you all for your help, and we'll entertain a motion for adjournment.
So moved.
Second,
I second.
all in favor, feel free to click off. Thank you so much.
Okay.
Bye.
All I can say to the staff is hang in there.
Sorry about that. That's not fun.
I'm sure.